Hey everyone, we are going to get started here. I would like to welcome Tina Reynolds. Tina is the program director at the Michigan Environmental Council for Environmental Health. She's been with us for about 15 years now, give or take, right, Tina? Is that, I get that close? Yeah. When Tina joined MEC, we didn't have an environmental health program at all. Of course, we cared about environmental and human health and its implications, but we weren't thinking strategically or systematically about that. And so over the last decade plus that she's been here, her role has really been to engage the environmental community and the public health communities together, addressing environmental harms and the environmental factors that contribute to human health. She's done some amazing things, like help create the Michigan Alliance for Lead Safe Homes, which has brought millions of dollars of remediation funding support to help people with, to low-income people with lead poisoning in their homes to get their houses cleaned up. She's worked on asthma. So anything that has to do with health, Tina's been our champion here in our office and in the legislature. Tina, welcome.
Thanks. Good morning.
We are also going to spend some time, well, we are going to spend some time today talking about environmental health and its implications in the coronavirus and COVID environment. It is coming off a really hard 10 days in the nation right now. We've all been struck by the response to police violence coming out of multiple states across the country, the protests in cities pretty much everywhere. Literally just yesterday, I was here on a call, I think with you, Tina, when a march went past my house. So the activism that we're seeing is inspiring, and I love seeing the response too from corporate America and others saying this has got to change. We've got to be a more equitable society. One of the mantras that has come out of the police violence movement is, of course, I can't breathe. And that has special resonance for us in the environmental community as well, especially when we start to talk about environmental justice issues and as they relate to the pandemic crisis that communities of color are experiencing. We have seen, as COVID has taken root in our communities, that communities of color and communities, low-income communities that are in close proximity to pollutants like factories or coal-fired power plants, they experience a particular environmental harm that results in public health harms as well, and it's unjust, and we are not responding to it in an equitable way at all either. Tina's been on the forefront of that work, and MEC is engaging in it more aggressively under her leadership. So we're going to talk a little bit about that today for the next 10 to 15 minutes. So, Eli, Elizabeth Fedora took the picture of the rotunda that was up at the beginning of our meeting. Nice shot, Eli. If you have questions, please post them in the Q&A button down at the bottom of your screen. That's what Tina and I will be monitoring throughout the next 15, 20 minutes for your questions. Tina, let's start by talking about how climate change and human health are connected.
Sure. Climate change, of course, one of the biggest impacts are to human health. And Michigan has done a good job with the MyChat plan, or the Michigan Climate Health Action Plan, specifically looking at climate threats to Michiganders' health. So some of the biggest ones are, of course, respiratory disease. We think about increasing air pollution. We think about asthma. We think about pollen and allergies. So respiratory disease will be one of the big risk factors, and we're currently seeing impacts for that now. Heat-related illness, heat islands, of course, we have increasing temperatures, increasing humidity. One of the things that climate is accelerating is longer high heat days, longer through the day, longer through the night, longer stretches. So the human body doesn't have a chance to recover. And so heat related illnesses and stresses will be something, especially in heat islands with lots of concrete and reflective buildings and not a lot of green spaces. Vector-borne disease, we hear as the climate warms, we have critters that are continuing to invade habitats where they didn't used to and stay here longer because our winters are not the freeze-thaw cycle. We're not killing them off. So we have Lyme disease in areas where we haven't. Last summer was a good example of Eastern equine encephalitis, triple E, that we're going to be monitoring. That was mosquito borne, as well as West Nile virus. And the Department of Health and Human Service put out an alert today. I believe it was a bird in Lapeer. We already have West Nile virus confirmed in the state as of today. We also have waterborne. We are all hearing about Midland and flooding and dam breaching. So flooding, devastation, destruction, E. coli on beaches, sewage and septic. So water is a big vector. And then in the public health community, this will be new for some of us that work on environment, asthma. Accidents. Accidents are a big one that the public health community takes a look at because it affects a large propensity of people public health wide. So an accident around climate change could be drowning, could be an injury while you're trying to escape a flood or a national disaster. Another accident could be slip and falls and car accidents and ice and snow events. And so those are the 5 big health related climate factors that we can anticipate seeing an increase in Michigan.
Are we seeing disproportionate impacts in any particular communities?
Yes, just like environmental health, climate impacts are to the very old, to the very young, to pregnant moms. Those are health-related stages of development kind of things. Those are populations that are vulnerable because of their age or medication. And we also are seeing a disproportionate impact on low-income communities. And those in Michigan, low-income communities tend to be communities of color, tend to be urban populations and some rural populations. And so those are the subgroups that we have to pay closest attention to. They're going to face the brunt of climate impacts.
So you spend a lot of your work interfacing directly with medical practitioners and public health practitioners. Mm-hmm. How are they seeing the interface between climate change and human health, and in those communities that you work with?
Yeah, it's been really refreshing. I can tell you in the medical and health community, and let me kind of define when I say that, who am I talking about? Yeah. When we think of medical and health, we think of clinical, right? Doctors, nurses, pharmacists, clinical care model. Also in the health community, I'm talking about public health, our health departments, sanitarians, health inspectors, those municipal and county folks that keep us safe and healthy, provide immunizations. And then also I'm referring to health advocacy at the Capitol and around. Health advocates would include the Health and Hospital Association, would include the Lung Association, Cancer Society, Easter Seals, Council for Maternal and Child Health. Those are traditional health messengers in the Capitol. Those are trusted messengers. Right. So when I talk about health community, that's who I'm talking about. The health community operates under the preparedness model, the public health preparedness model. And so they didn't get mired down into the discussion of climate change. Does it exist? Who caused it? How bad will it be? Can we fix it? Should we care? So no, there was not that kind of a debate, that kind of a political, rhetorical debate in the health community, pretty much their preparedness model in the face of, health impacts that they're seeing. Even without final science, definitive science, they start preparing. And so public health, that community has been rolling up their sleeves. They've been treating patients. They've been really active on the national and state level about climate and health. And they've been working on planning and preparedness. And so the health community has, kind of rolled up its sleeves and operated, trying to adapt to the changes that they're seeing. I can say there are challenges within the health community. That sounds awesome, and it is awesome. But part of the problem is with the healthcare delivery model that we have in Michigan and many other states. When you go to the doctor, you have a 15-minute office visit, a 20-minute office visit. You have a specific condition or two that you're talking to your doctor about. And so education and outreach and talking to patients about climate impacts and, linking health and environment together are something that we're not able to see on the local level. And so that is a challenge. But the health and medical communities are very strong climate and health advocates. They are connecting the dots. They might not be using the word climate. Resiliency tends to be something that they use. Mitigation versus adaptation tends to be something that they use. But they really pride themselves about staying out of the fray, being clinical, being very science-based.
Two of the big coalition areas of your work are around food security and asthma. Are those coalitions having different kinds of conversations about climate change now?
Of course, because they're different subject matter. So asthma is going to, our coalitions are looking at outdoor air quality, ozone action days, hospitalization, acute hospitalizations, exacerbations because of asthma, looking at ports and trucks and diesel as far as exacerbators of asthma and climate. Healthy food access, my healthy food access work is especially in light of COVID, as we're seeing empty grocery shelves and we're hearing about farmers who can't get, their goods processed. And so they're dumping milk and they're dumping meat. The healthy food access folks, we've always, really worked at local, healthy, sustainable foods, food hubs, connecting local distributors and healthy produce. And, so that's becoming even more of a focus right now in the legislature. One of the priority pieces is the 10 cents a meal that an MEC member group, Diane Connors, up in Traverse City is working on. And that's to leverage additional dollars for healthy local food to school kids. And so, yeah, around climate, just preparing for adapting to and making sure that we can all be healthy as we're working to stop the impacts of climate.
So for residents, like their major interface around health is either their doctor or perhaps their local health department. How do they engage with these entities in order to make sure that human health in the face of climate change is being elevated and discussed, and that they can advocate for better policy and better reform?
Yeah, that's a really good question. I think we have some super savvy people on our call. And so when we talk about climate change, like we're all probably either aware of or trying to or thinking about, personal consumption and green cleaning and making choices, for our family about are we walking or biking? Are we taking public transportation? So those kind of, initiatives that are really, really important that we can make as individuals, I bet a lot of us are doing and knowing about. So I really wanted to highlight, how can we interface with the health community and, kind of widen our tent. Health messengers are the most trusted messengers in legislature and by the public in general. Nurses rank at the very top of who do I believe, politicians, usually at the very bottom. And so, being in partnership and being in coalitions and networks with health providers and health network people, elevate credibility. And how do we interface with them? Well, Conan mentioned local public health. Every county or group of counties has a local public health department, and they have environmental health officers. They have folks that are, working on the same kind of issues that environmentalists are working on. They have county health board meetings. They have subcommittees. They do county level planning. And so, plugging in with your local health department and figuring out who's meeting, what are they talking about? And if you're interested in climate and health, you're probably going to be one of the 10 or 15 people in that room. And then you can put your ideas and initiatives forward. It could be adopted in a countywide plan. With hospitals and health systems under the Affordable Care Act, there is a community health assessments need that is required under the Affordable Care Act. And so you have hospitals now on a regular basis needing to have stakeholder and community meetings talking about this is what our community says are some health issues and health concerns in our neighborhoods and in our areas. And they have to devote a lot of money to those initiatives. And so if you're present in those rooms, you can raise up those issues issues about how about we have a ride share, or do we have cooling centers, or, you know, whatever you feel like is important in your area. Those are areas that you're able to make a really big impact, because with the plan comes the dollars and comes the mission. And if you're there to help set that plan, you can do well.
You know, I worked on the city of Detroit's community health assessment in 2018, doing part of their public engagement. And you're right, like that is a tremendously robust process with a lot of opportunity for citizen and professional engagement. That's great. People can learn about those on their county public health websites or their city public health websites. What about
people and connections that you can leverage in other ways, right? So don't just show up at a meeting or two, you know, be engaged in this group, be supportive, and those could be allies.
What about your own work? Like what's happening in the Capitol right now? You know, we have human health crises all around us, and then the budget, the state budget is looking at perhaps a 30% cut to the general fund. What's high on your agenda right now?
You know, everyone in MEC is keeping an eye on the budget. You know, we have between $3 and $4 billion budget deficit that we're looking at. Will we get federal dollars? Will it come in time? You know, there's a lot of anxiety. Michigan has a requirement for a balanced budget. Our Constitution requires us to only spend what we anticipate we're taking in. So we can't do deficit spending here. And so, of course, keeping an eye on the budget, what decisions, you know, we're talking a lot about health and environment and human health and protecting human health. But when the rubber meets the road, is this funded? Other work that I'm looking at and doing right now is in asthma and outdoor air quality. You know, is Michigan going to be in compliance for ozone? If we're not, you know, starting to take a look at, you know, what would that look like to get us into compliance? I'm pushing for, instead of regional compliance mechanisms, let's statewide. You know, let's have statewide ozone attainment requirements if we need to. That will improve air quality for everyone. That'll level the playing field for businesses. Healthy food access, I did mention the 10 cents a meal, that is in the budget right now. So to preserve those dollars to support local farmers, and that will, you know, help with sustainability and then feed our kids through my lead poisoning prevention, weatherization, energy efficiency work, you know, trying to get services deployed to low income communities to, you know, make sure their homes are weatherized and have energy efficiency upgrades, one, that reduces the carbon footprint, and two, you know, they're healthier in their homes. And so those are some of the priorities that, you know, I'm taking a look at personally and looking always for opportunities in the legislative process.
I placed up on the screen for everyone links to the MEC website and ways that you can connect with folks. And Tina also manages a handful of really influential and important coalitions. Tina, do you want to talk a little bit about the ways that citizens and professionals can engage via your coalition work?
Sure, yeah. So the Michigan Alliance for Lead Safe Homes, Conan talked about at the beginning, we're a big coalition on lead poisoning prevention. We have state, local, federal officials on there. We get updates with what's going on, including funding opportunities. We engage in capacity building. We have Lead Education Day in the Capitol, and would love to have you. We have lead impacted parents and families. We have contractors, you know, a whole group of interested parties. Through Healthy Kids, Healthy Michigan, our Healthy Food Access Group is another group that's a monthly meeting, and both of those are completely online. So there's not a big in-person commitment for either, but working on, you know, food access, food justice, you know, food pantry work, working on local sustainable food systems and farmers. And that is a really interesting coalition too, if anyone is interested.
Tina, we started talking at the top of the hour about how the coronavirus pandemic has exposed a number of the frailties in our system, especially for communities of color and low income communities. And the need for environmental justice is at an all-time high. Can you talk a little bit about how your work interfaces with communities of color, low income communities, and this call for environmental justice?
Right. Well, most of the environmental health work that I work on is really targeted at low income or vulnerable populations, children and families. And those are, folks that tend to be located in urban areas or very rural areas. There's a lot of income disparity, a lot of health disparity in those groups. And just being able to help advocate for clean air, in-home supports around a green and healthy home, around mold and moisture and asthma triggers, healthy food access for communities that may not have a full-scale grocery store. It's really hard to be healthy if you live in an unhealthy home. People spend 80% of their time indoors. If you have pests and you have mold and you have moisture and you're struggling with, your utility bills and it's too hot, there are clinically defined metrics out about how your health is adversely impacted. A lot of folks that we work with, especially in my lead work, are in rental properties and in rental communities. And as a renter, you don't have the ability to make upgrades to your homes. And so being a voice and working for, populations on those issues to improve both indoor and outdoor environmental health contributors it's basically 100% of what I do.
So the Whitmer administration has been fairly aggressive on both environmental justice and on climate change. We have two bright new leaders inside the Department of Environment, Great Lakes and Energy, interfacing around that. Are you optimistic about what's happening with the administration and our ability, Michigan's ability to respond?
Yes. I mean, I think having those offices really helps elevate the issue. It helps, be a place where stakeholders can come together. A lot of our state departments are big and they're bureaucratic, and you're not really quite sure who to call, what to do. So having a really open face and having those offices, I definitely would like to see more funding for those offices, so there is support staff, so that there is more of a statewide approach. We have great individuals who are there now, and it would be great if we could help build their team, because we all know you can do better work if you have a better team and more support there. And that's going to be particularly challenging with the budget that we have now. And so incredibly excited about the outward face. Incredibly excited about renaming of Eagle, to kind of integrate a little bit more some of the priorities that we're working with. So yeah, really excited about what we're seeing, and then, keeping an eye on, making sure the resources follow.
There are strategic initiatives inside those offices that have direct implications for environmental health.
Well, I know that both of those offices are relatively new, and they're engaging in a listening session. And so, it's really exciting to, have the ability and the mandate to kind of go around the state and to listen. It seems like if we all listened a little bit more, that we would be more effective at our jobs, and we would overall probably be better human beings. And so, the initiatives that I'm excited about at this point is just their willingness and recognition of how important it is to get out into the communities and to listen and hear what people are saying about what their priorities are. And so, I'm really encouraged about that. And because I think people in general are really smart. We know what we need if people just listen.
I want to get you to do a little plug for one of our key partners. You mentioned the importance of funding for state initiatives, but obviously that's equally important for community-based initiatives, whether those are within your local government or through the nonprofit community. You are a board member with the Michigan Health Endowment Fund, which has a $4 billion endowment, and they give away lots of grant funding for health-related strategies every year. What are you guys looking at through the Health Endowment Fund this year?
Well, the Health Endowment Fund, has specific grants and specific grant time periods. And so those will be coming out again soon. And so I encourage people to kind of take a look at those. The Health Endowment Fund staff are really, really awesome to work with. They're very open to having conversations. It's a group that intentionally makes applying for dollars as easy and hassle-free as possible. And so I encourage you to look at their site, to reach out to their program officers. They'll talk to you about your proposals, if it'll work or where you should, how you should apply for it. We were at MEC before I was on the board, a recipient of Health Endowment Fund dollars for our healthy food access work. And I can say, being on the giving side and the receiving side, it's really a wonderful opportunity. One of the things I really like about the Health Endowment Fund too is they work very closely with state government, and they have kind of proactive funding proposals. So they'll work with state government to say, if you had money, what would you really like to be doing to help serve populations of Michigan? And so they kind of have a grant process where they can help seed a program or an innovation on behalf of the citizens that we don't have general fund dollars to do. And then, when the program is successful, and most of the time, we pick winners, then, general fund dollars or other dollars will help support that just to kind of launch. But they're great with, community partners. A lot of environmental health and environmental priorities can be found. But you're going to have to dig a little bit because these are Blue Cross and Blue Shield dollars, and there is a clinical health and modeling mindset. So you're going to need to be a little bit creative if you have an environmental project. But they're great to have a conversation with, and it might be a good funding match for you.
Nice. Well, Tina, thank you so much for taking time out of your day to do this with me. I am always super impressed by not just the depth of knowledge that you bring to these issues, but the breadth of your activities. Like, you're touching on so many of these spaces, and the environmental community. Michigan's society is really lucky to have you. And thanks for talking with us today.
Well, thank you so much. And we're all going to stay active and busy and keeping an eye on things in the legislature over the summer. And so we'll keep you posted for other developments that might be interesting to you.
I want to say thanks to everyone who joined us today on the webinar as well. This is part of a series, so keep your eyes peeled for future invitations to talk with other experts throughout the state of Michigan, MEC staff, our allies, academics, and even the occasional lowly rated politician. So please join us again in the future, and thanks for giving us a half hour of your time today. Take care, everyone.
Bye.